fibrous growths within the uterus. If you've ever felt cartilage or like the kind of gristle of some chicken or something like that, or rib, it feels like that. It's a dense fibrous growth that actually occurs in the muscle of the uterus. Our uterus is actually comprised mostly of muscle, and that's why it can kind of expand in a pregnancy or it can contract down during a period. But these little balls or growths can occur within the uterus and they can grow over time. The stats say 70 to 80% of women will have fibroids by the time they turn 50, but they don't always cause symptoms. They don't always affect a person in any particular way. And Black women are more likely to not only have them, but to have more symptoms caused by them at an earlier age.
I'm not afraid to write a brand new story. And when changes find a way to me, I can keep it moving. I'm not afraid to celebrate my glory. And when challenges grace my path, I know I can face another day. Inside, I rise, daring to learn. With Fox After 40.
What's up, you guys? Welcome back to Fox After 40, where we focus on all things women's wellness. And today we're talking about fibroids with Dr. Wendy Goodall. But before I intro her, I'm going to go ahead and read her bio. Dr. McDonald is a board-certified obstetrician gynecologist and published author. Known in the media as Dr. Every Woman, Dr. McDonald shares evidence-based health information to educate the masses and inspire future physicians through music and literature in fun and innovative ways. Dr. Wendy, thank you so much for coming on the podcast.
Thank you so much for having me. I'm honored.
So, Dr. Wendy, can you give us a little bit about your background before we jump into fibroids?
Sure. Chicago girl, born and raised. I've been in practice since 2011. So I finished my residency in OBGYN in 2011. So I've been doing it for a minute. I'm older than I look. No, I look the same age that I am. It's fine. I also, wife of 19 years, a mother of 3, and I've had fibroids myself. So can speak to a little bit of that journey as well, but, able to kind of overcome it, which is wonderful.
And what services are you typically offering right now with clients that you have?
So I take care of humans with vaginas, women, if they identify as such, and those who don't. And I take care of people from adolescents all the way to whenever they stop coming to see me. They could be 95 years old and I'm still going to take care of them. I deliver babies. I care for people during their cycles, just general wellness, cervical health screening, STI screening, which is sexually transmitted infection screening. We deal with PCOS, endometriosis, heavy periods, all the things. And again, babies.
Thank you. Okay. So I've been dealing with a lot of friends who've had fibroids.
Yeah.
And I assume that maybe I'll get them one day. My mother had them before. But what are they exactly? Because I think most people don't know what fibroids are.
Sure. So fibroids are fibrous growths within the uterus. If you've ever felt cartilage or like the kind of gristle of some chicken or something like that, or rib, it feels like that. It's a dense fibrous growth that actually occurs in the muscle of the uterus. Our uterus is actually comprised mostly of muscle, and that's why it can kind of expand in a pregnancy or it can contract down during a period. But these little balls or growths can occur within the uterus and they can grow over time. The stats say 70 to 80% of women will have fibroids by the time they turn 50, but they don't always cause symptoms. They don't always affect a person in any particular way. And Black women are more likely to not only have them, but to have more symptoms caused by them at an earlier age.
Why are they a problem? If they're just like gristle, like in chicken, why can't they just stay in the body?
No, that's a good question. Think about muscle within the uterus and how the blood vessels run through it. When their period comes, those blood vessels will release blood and the muscle around those blood vessels will contract down to kind of control how much blood you're losing. Almost like a faucet or a sink. You can turn it up, you can turn it down, you can kind of meter that, right? Well, when you have this gristle, this firm fibrous growth, and if blood vessels are running through that, it doesn't contract down. So now you have a pipe without any kind of spigot on it, letting blood come out. And so that's why fibroids can cause really heavy bleeding, because there's not the ability for the blood vessels to contract around like they should. And also, even if they're not causing heavy bleeding, which they don't always, sometimes they cause mass effect or like pressure because they're big. So they can push on the bladder, they can push on the bowels, they can make a person look pregnant when they're not. that kind of thing.
So are they always there, or no, they just grow out of nowhere?
They kind of grow out of nowhere because you can take fibroids out, like as many as you can possibly get with the surgery, and then that same person may get more later in life. It's not the same as certain types of tumors that are there when you're born and then they just grow over time. These are actual growths that occur within the uterus.
Wow. Okay. So I might have fibroids, but they might be benign or nothing issue, and they can just leave them there.
Exactly. It's not uncommon for me to do an ultrasound for somebody either in pregnancy or even just some incidental finding. Somebody comes to me because they had back pain and they went and got X-ray or CT scan. Usually not an X-ray, it's usually a CT scan for their pelvis, and then they're like, oh, and there are fibroids in the uterus, incidentally found.
And you could just leave them.
Yeah.
Are there things that people do that make their fibroids grow quickly and or bigger?
Sure. There's correlation. So let me start off by saying the science around fibroids is lacking. Okay. We need to know more than we do. But what we know is that there are certain things that are correlated with increased fibroid growth. Vitamin D deficiency is one that's correlated. Being African American, honestly, is a risk factor for having fibroids. Being overweight, because the estrogen that can occur in a person who has more adipose tissue can actually feed the fibroids to an extent. Fibroids can actually grow in pregnancy, but then they often shrink to smaller than they started afterwards. Again, hormonal triggers. Processed foods, so people who have diets high in processed foods or ultra processed foods, those foods that aren't really what they started as, right? They've kind of been changed into other things. Diets high in that and low in green leafy vegetables, fruits and vegetables. That's also correlated with higher fibroid growth. So even though a person may do all the right things, eat all the great things, have no risk factors, they can still get fibroids. But the person who does those other things is more likely to have more and more symptomatic fibroids.
Can fibroids be cancerous?
Yes, but in a very, very small percentage. That's called leiomyosarcoma, which is like less than 1% of fibroids. So that the great thing about that is that whenever we see fibroids as clinicians, we're typically not worried about them being sarcomas unless they're growing really rapidly, causing symptoms that, we didn't expect. And again, a person goes from practically nothing to something that's double or triple its size in a year. That gives you a lot more suspicion for cancer, but the majority, over 99% of fibroids are benign.
And if they are cancerous, I'm assuming there's just a surgery to take it out.
Correct.
Gotcha.
Yeah.
So you don't have to go through like chemo or anything like that.
You may. You take it out, you take the whole uterus out typically in that situation, and then you may actually have to have further testing or further treatment.
So I guess that's a hysterectomy, correct? Taking out the entire uterus.
Correct.
What are the effects of that?
Of taking out the uterus?
Mm-hmm.
Well, depending on when a person is getting it done, and depending on if they take out their ovaries or not, that might lead to menopause, early menopause. If their ovaries remain, it would not necessarily. Depending on the extent of the surgery, like a surgery to remove a cancer can be more extensive. We may have to dissect into lymph nodes and kind of do more extensive dissection, which can cause a harder recovery than a surgery that's just done because there's just fibroids there and we're not concerned about cancer.
And I'm assuming people can't voluntarily say, hey, I want to take out my uterus. You guys don't do that.
I mean, I wouldn't say we don't do that, but we don't do it commonly. It takes a lot of counseling because that's a pretty major surgery. I mean, it's like, ask me today to take somebody's engine out of their car. There's a whole lot of things that are connected to that and a whole lot of parts. It's not just snap your finger and it's done.
Yeah.
And so there are risks of damage to the ureters, which are the tubes that go from the kidneys to the bladder, risk of damage to the bladder, the bowels. There's a lot of things there. So we really want to make sure that if a person needs a hysterectomy, the need outweighs the risk, right? And if the need doesn't outweigh the risk, that doesn't mean the person doesn't have autonomy and can't make their own decisions, but it may just require a lot more conversation to make sure the person understands what they're getting themselves into.
What age do you see people start to get fibroids?
I start to see more symptomatic fibroids, often in a person's either late 30s, early 40s, or in their 40s.
And what are some symptoms that you may have fibroids?
Heavy menstrual bleeding, heavy periods.
What is categorized as heavy?
Good question. So there are standards. They say 80 milliliters of blood per cycle. Who knows what that is though, right?
I was like, what is that?
Right. Who knows what that is? So what I tell people is if you are soaking a period product more than every couple of hours, or if you're wearing two period products and you're still soaking through them, or you're messing up clothes, or you're messing up your sheets at night, you're absolutely losing too much. A person could still be losing too much and not maybe to be be bleeding to that extent. So we may check a blood count if they're just kind of like soaking their period product every 3 hours, but they're doing it for 7 full days. Well, then we're going to check some labs and see if that's, translating into anemia or any other symptoms in that regard. But if they're just, if they're really just bleeding through, hemorrhaging essentially from what they're describing, that's too much. And that's often a sign of fibroids.
If you've enjoyed this episode of Fox After 40 and want to get notified about the next episode when it drops, make sure to go to CurlMix.com and sign up for our mailing list. We'll notify you whenever a new episode comes out. What if it's just like hemorrhaging like the first few days?
Depends on how many is a few days. Is it 1 day? Is it 3 days?
3 to 5.
That could be a lot. That could be too much. No, I know. I hear it. I heard it. I was there with you. It depends on how much and what, like how frequently. I mean, it could be too much. It could be too much.
And is this something that's common like after giving birth? Like, how do you know it's not just a result of like heavy bleeding? It's not a result of just like, hey, I have kids and it wasn't this heavy before, but now it is, or it's actually fibroids. Like, do I have to go to you to get tested? So fibroids, thankfully, like unlike a lot of other medical issues, some medical issues, you got to catch it at the right time, get the labs at the right moment to detect it. Fibroids, because they are literally a mass, you can see them. You just got to do imaging, So if you've never, it's not uncommon for a person to come to me and tell me they've had heavy bleeding for all this time. And then I'm saying, have you had an ultrasound? Never. Has anybody ever offered you imaging? Never. I'm like, that's the first thing we need to do. We can still check labs, blood count, thyroid. And to your point, having had children does sometimes change the uterus, sometimes for the better, sometimes for the better and sometimes for the worse. So you want to make sure that like, how can having children help your uterus?
Oh, I've seen it. Periods for some people, and I think that actually does speak to maybe fibroids if they were there shrinking afterwards. Periods get better for some people. They get lighter, they get shorter, and then some people they get worse. And is that just the uterus's shape has changed or the size of the cavity has changed, or is there something new in there that we don't know about?
Okay. So let's say someone's been living with fibroids for a decade.
Yes.
And maybe they have heavy bleeding, but then they go through menopause. Like, do you have to take them out? Can they just stay there?
No, you don't have to take them out. And the good thing about menopause is that often they'll shrink. So we're talking about a usually 30% shrinkage, and they're no longer bleeding or asymptomatic. So I often will try to get my patients in menopause. Are we close? Are we close enough? Are we 30, 49? Are we 50? Are the symptoms starting to get a little better? Let's just wait a little bit longer because maybe this whole situation will fix itself and we don't have to bring this person under the knife. But a person who's having really, symptomatic fibroids and they're in their like early 40s or something, you might not have that chance to wait a whole decade until they're menopausal.
Oh, this is fascinating. So many questions popped into my mind.
Yeah.
One of them being, what does the surgery look like for fibroids?
Depends. There's a lot of different types.
Okay.
And that's good because back in my day, when we first started training, it was hysterectomy was one of the main things that you did. And we still do those, but we have a lot of options before that. So the first question is, where are the fibroids? Are they inside of the cavity of the uterus or the wall of the uterus? Are they on the periphery of the uterus? If they're in the cavity of the uterus and they're small enough, even if they're little, they can be small but mighty. They can be bleeding really heavily from really small fibroids. So we can actually take a camera, put that into the uterus and shave down. I actually did this yesterday 3 times for 3 different people with fibroids in their uterus.
Look at you, superhero.
I know. It was just like, just yesterday, okay? Just yesterday. 3 different fibroids. So you shave them down and you take them out. That doesn't even require any incisions. It just goes, through the vagina while a person is asleep. So that's a hysteroscopic myomectomy. There's laparoscopic myomectomy where we can take the fibroids out through small incisions through the belly with little instruments. There's abdominal myomectomy. That's a C-section incision people talk about where you actually go in and pull the uterus and take everything out and then put the uterus back where it belongs. And then again, there's also hysterectomy. There's also radiofrequency ablation of fibroids where we can put an energy delivering device into the fibroids, whether through the vagina hysteroscopically or through the belly laparoscopically, and heat the fibroids up to the point of cell destruction and make them shrivel up and essentially die. So that's not removal, but it's treatment. And then there's also uterine fibroid embolization. So uterine fibroid embolization is done by an interventional radiologist where they put occlusive beads into your blood vessels that feed the uterus, and that strangulates the fibroids because it cuts off their blood supply and also makes them shrivel up. So there's a lot of different modalities to treat fibroids. Some of them are more invasive, some of them are less invasive, but a lot of options.
This is so good.
And then there's not even surgical stuff. There's medication. There's medication we can use to reduce the hormones that feed fibroids. There's birth control, which is just as separate than the medication I'm talking about right now. So there's a lot of options.
Oh, this is good. Okay. You mentioned heavy bleeding as a big symptom. Are there other symptoms?
Pressure, pain. You know, when we think about really painful periods, sometimes we think about endometriosis, but sometimes it's fibroids that cause that. The pressure symptoms, I've had people who have difficulty moving their bowels, or they feel like they have a mass that they kind of can, feel from the outside. They can't hold their urine because their bladder can barely fill because they have big fibroids. So those are all mass effect type of symptoms.
What's the largest fibroid you've seen?
I've taken out a fibroid that was probably the size of a watermelon. I mean, it was about 30 centimeters. And the funny thing about that, and I still see her to this day, when I saw her, she didn't come to me for the fibroid. She came to me for her annual exam, and I went to do her exam and just touched her belly. And I was like, what's this? She's like, what do you mean? What's what? I'm like, what's this?
This watermelon.
And she's like, oh, that's not supposed to be there. I'm like, no. So we did an ultrasound, and sure enough, it was a big mass sitting on top of her uterus. So it was actually, despite how big it was, really easy to take out because her uterus was just like down here, and it was this big old ice cream cone on top. It was crazy.
Wow.
And so she wasn't having heavy bleeding or anything, but she just had this big mass. And then once she realized what it was, she goes, I guess I have kind of noticed that, but it was so gradual over time. She didn't really key in on.
So she was asymptomatic with a size of watermelon fibroid in her. Wow.
Had to go.
Crazy. Mm-hmm. I'm sorry, I'm stuck for it. I'm just thinking about that for a second. Like, how long had that been growing? And then and it had no issues. So it's like, well, do I take it out or do I leave it?
Well, and so the only reason why I told her that one needed to go is because it was so big that even though she hadn't keyed in on symptoms, it was to the point where it was going to start pushing on her diaphragm. It was big, it was too big to stay. And the more fibroids like that grow, the more extensive the surgery has to be to take it out, because now your incision has to get bigger and all of those things. So it was it just didn't need to keep growing at that point.
Do fibroids impact your ability to get pregnant?
Not always.
Okay.
If they're not in the cavity of the uterus, or they're not distorting the cavity of the uterus, they can stay. I had my fibroid that was my big mama, was about the size of a softball. And wow. I was pregnant and didn't even know it was there until along the way, we kind of obviously saw it. And then you could feel it from the outside. You could feel my uterus, my pregnant uterus, and then you feel this mass kind of to the right. But yeah, it wasn't in the way, so it got to stay.
So there's not much you could even really do to prevent this. It might happen, it might not. If it does, to take care of it. If it doesn't, lucky duck, but
Yeah, but I do think that there is something to be said for really being intentional about our health, because I think that the way our society is set up, fast food is so easy to get, even processed foods. So it's nothing to eat some chips or eat some cookies or some, cupcakes, and all of that stuff is considered processed or ultra processed and has been linked to more fibroid growth. So if we can try to really make sure we're getting on our green leafy vegetables, we're minimizing some of those other foods. I'm not saying we can't have them at all, but we're trying to really be mindful of diet and exercise. I think those are the things that we can potentially impact. Even if it doesn't completely eliminate our chances, it helps us.
And what percentage again of Black women get fibroids?
Well, the percentage of women is 70 to 80% total, and Black women are closer to that 80%.
Do fibroids have any other effect on weight gain and things like that, or no?
And they can weigh some poundage, right, or ounceage, but even the big ones usually don't get more than 3 or 4 pounds.
Okay.
So, I get there's mass there, but they don't produce hormones, they don't release anything, they're just there.
Gotcha. And so it doesn't impact your hair or anything like that?
No.
Okay, this is good to know.
Yeah. Not by any knowledge that we are aware of, because it's one of those things, again, it's not very well studied, but we know they don't release anything, they don't produce anything, but they are responsive to hormones.
And because it's in your uterus, I'm assuming it doesn't impact your sex life.
Not unless it's causing pain or discomfort, because if you've got a big massive uterus that's knocking around, that might be more uncomfortable than if it wasn't,
Gotcha. Okay, cool. Do fibroids increase the risk of getting any other kind of issue outside of heavy bleeding? If you've gotten any value from listening to Fox After 40, you learned a beauty tip, you've gotten advice, you shared the episode with a friend, please do us a favor and leave us a review on Spotify and Apple. It goes a very long way in helping us continue to build the podcast. Thank you so much, and I'll see you in the next episode.
No, but I will say that anemia can cause other issues. I had a patient the other day I was talking to, and she was like, yeah, my bleeding is really bad, but it doesn't really bother me. I'm like, but your hemoglobin is 8. That's not great. Your blood count being so low. The body is working overtime to try to rebuild this blood count, it's pulling nutrients from the whole part, all the body to try to make that work. And so it's running on empty, running on that depleted, blood count is just not good for anyone. Your bone health, your just overall health and well-being, fatigue, energy. So I think to the extent that a person's anemia can affect their body, they do, but I don't know that they physically cause any other issues, like any other tumor growths anywhere else or anything like that.
And I don't know if this might be a touchy subject, but does insurance typically cover the cost of fibroid surgery entirely?
I won't say entirely because there's always a copay or deductible or co-insurance, but it is a legitimate thing to treat, right? Like, it's not that we're like, oh, you have fibroids, and like, so it's like, no, it's, symptomatic. In fact, the way we code it is symptomatic uterine fibroids. You don't actually code the treatment of fibroids as just uterine fibroids because, again, they don't always cause symptoms. But for whatever symptom they're causing, if we code it as symptomatic uterine fibroids, it is a coverable, manageable thing.
And are fibroids typically the result, or can you say, for example, if you're dealing with something like breast cancer or you're dealing with like other kind of issues, does that create more fibroids?
Good question that I can't say that I can answer completely. So when we treat breast cancer, there's a medication that helps to suppress the estrogen levels in the breast, but they can actually increase the estrogen levels in the rest of the body. So I've seen people who have been on like tamoxifen, which is one of the breast cancer like post-treatment medications, and then they've developed like polyps or things in the uterus. We think it's in response to the tamoxifen, but not necessarily fibroids. But in theory, if I could like make the math make sense, I would think they could. Mm-hmm. But I can't say that I've seen that in practice, nor have I seen that in studies per se. Yeah, that would cause it. But I know that those medications can impact estrogen growth, or the estrogen in the body, which can impact fibroid growth. I will also make mention of, because I hear this a lot, that, birth control can cause fibroid growth. And actually, birth control is not correlated with fibroid growth or increased fibroid growth. And some types of birth control have actually been shown to stabilize fibroid growth. So we're talking about the progestins like in an IUD. People who have higher estrogen levels in their body, that progestin works as a counterbalance to that estrogen and can actually keep the fibroids at bay, essentially. So sometimes it's one of our ways to kind of stave off growth or symptoms is to use certain types of birth control.
Do your clients come to you for recommendations on birth control?
Yeah.
All the time? Mm-hmm. Yeah. Do you have a favorite?
No.
Or something that you typically recommend?
I don't have a favorite. I am a card-carrying member of an IUD. Okay. And I usually don't keep that information to myself because IUDs have a bad rap on the internet. So it's always like, oh my God, I've heard horror stories. That's the word people say. I've heard horror stories. And I'm like, but they're good. Most people love them. It's like the stories you hear sometimes are the more extreme, but most people actually love them. But that doesn't mean that they're for everybody. So I'm not somebody who touts like everybody needs an IUD. I actually tell people about all of their options because different people, one option's better for them than the other. The pill is easy for some people to take every day and just kind of not be worried. Others can not think to remember to take a pill every day. So then it's like, well, would you do better with a ring or with a patch? The patch is not my favorite. The shot is not my favorite because of side effects, not because of what they are, but just because of how they can cause certain side effects in people.
I had the little toothpick. I guess Nexplanon.
Mm-hmm.
Oh my God, I gained like 50 pounds.
Yeah,
and I was just like, I wish I had known.
Yeah, that one can do that too.
One of the questions I do have when it comes to birth control, and I know we were talking about fibroids, but then you mentioned birth control, and it's not something people really talk about for women after 35, 40, because they just say, I'm like, so are people on birth control? Yeah. I'd imagine, when can you stop? You know what I mean?
Yes,
like, when can you
yes. So I'm 43.
Okay.
And I'm on my second IUD. My periods were trash before I got my IUD. So that's what made, that, and I didn't want no more babies. So I was done with that. But also I was like, I'm not going back to these awful periods. Okay. So my patients who are like me in this era of our 40s, it's often for symptom control of their cycles, but it's also for contraception. I mean, we've all heard the stories of people who are 45, surprise, it's a baby on the way. Like,
I have a aunt, sorry, my nose was like, it's running. Is it okay?
You look good.
Okay. My aunt, she's like in her 50s, and I always joke, I was like, oh, what if you got pregnant? She said, please do not make that joke. That's not funny.
No, that's a shoot. I'm like, no, keep that energy away from me.
So how long do people have to be on, not have to be, let's say you don't want kids, right?
Sure.
Like, when is an appropriate time to stop taking birth control?
when you're menopausal, or at least in the throes of perimenopause,
Okay.
which if you're not on birth control, it should be easy-ish to know, the classic symptoms: hot flashes, night sweats, brain fog, weight changes. And those can be sometimes not super clear that they're perimenopause. Sometimes it's like thyroid issues and stuff. So it's also worth kind of chatting with the provider and just making sure that that's what's going on. But if you're, late 40s, early 50s, and you're having those symptoms, then you probably are good to not be on birth control anymore, because you're going through the change, as they say. But until then, technically these eggs could be fertilized. So you should be real careful. Now, if a person is on birth control, it can be harder to tell, right? Because the symptoms might be muted because of the birth control. And so you may have to just periodically, like I've had my patients in their early 50s just go off of their birth control for 2 or 3 months and use something else for contraception if they're active, but check their labs or see what their body is doing. Do their periods come back? If your periods come back regular, scheduled, you still need to be on something.
So if you have a period, you need a regular period, you need to be on something no matter what your age is.
That part.
Well, Dr. Wendy, this has been phenomenal. I feel like I learned so much. Look, I might need to go to the doctor. Get checked.
Look, sound like I'm like, sis, talk to me after this, okay? Talk to me after this.
But I also wanted to tell people, you brought me a gift.
I did.
A special gift. Let me open it. All right. She asked me my size.
I did.
And so can you tell everyone, these are beautiful shorts. I love it. I cannot wait to wear them. So can you tell everybody what I'm holding here?
So I decided too long ago that I wanted to bring everybody to my side, which is I don't wear drawers. I don't wear panties. Let me be specific. I do wear drawers, but I don't wear panties because I think they are restrictive and they are not vulva friendly. And so I have been wearing men's boxers since my early 20s.
Okay.
But they look like men's boxers. We always joke in my house that my underwear and my husband's underwear look the same, So a couple years ago, I said, well, why can't I make something that look more like mine? You know what I mean? So those are a pair of Every Bottoms.
I love it.
Which are my line of women's boxers. They are 90% cotton, 10% polyester for the strength and fortitude of the fabric. Very breathable, very light. A lot of people will sleep in them. I actually wear them. I'm wearing some right now. I wear them all day, every day. I sleep in them. But yeah, it's just my answer to, trying to give the vulvas freedom. I
love it. Let the vulva breathe.
That part.
I'm not gonna hold you. When I got pregnant for the first time, I stopped wearing
Look,
underwear. I was like, this stuff is cutting into my thighs.
Uncomfortable.
It was so uncomfortable. And then once my babies were born, I was like, why do I wearing these?
Don't nobody got time. But see, for me, I do want a barrier between my clothing and my person.
Yeah, of course.
That's why I do exist in boxers. But it feels like I don't have on drawers, which is the goal.
Okay, I feel you. I wear them sometimes,
Yeah.
I'm wearing them right now.
There you go. Well, I got some of those on. I'm glad, but I appreciate you for letting me give you some.
No problem. Is there anything you want to leave the people, any parting advice about fibroids, birth control?
I think that, having a relationship with a provider is important. A provider that you trust is important, because I think that sometimes it's the fear of the unknown that lets us not ask the questions or lets us ask the internet the questions. And I'm on the internet, so no shade to the internet, but sometimes the internet can steer you wrong.
All the time.
And make you nervous and afraid and not know what to do and what direction to go, or even sell you things that tout as, oh, it'll treat this and it'll shrink that. And it's like, there's, let's work together to try to make sure that the person that you are safe and healthy.
And I appreciate you for all the information that you share on the internet. You're a full-time doctor. Like, you don't have to be on the internet giving people medical, letting them know, steering them in the correct direction. Because people going to ChatGPT, and ChatGPT is just an amalgamation of information.
Yes.
So it's like, is this accurate?
And not discerning, right?
Exactly. Or like cater to your specific situation.
Right. So I appreciate it. And I enjoy that space, honestly. Half the time, 90% of the time, the things I share on the internet are questions that have been asked of me multiple times recently. And I'm like, that's the topic we need to talk about.
I love it. Where can people find you?
If you want to find me in Chicago, I practice as women's health consulting. And just Google me. I'm there. But also I'm on Instagram, YouTube, TikTok under the name Dr. Every Woman.
Oh my gosh. Amazing advice, you guys. Absolutely amazing advice. Make sure you follow her. Check out her practice if you're in Chicago. You want to fly for a consult. You can do that too.
That part.
And thank you guys so much for listening. Make sure to like, comment, and subscribe. Watch this episode and more. We're going to do a part 2. Make sure you stay tuned for that. And thanks for listening.